I'll put you in front of my melody. Hey, I made it in life. Can't you see my baby carrier? You think it's easy to carry a baby in a baby carrier? You don't take what this thing don't they hungry me. Mama Nkechi open bail last week. I buy am 955 naira. You get plenty nonsense things for that baby, but I managed to see this one. So I know they back my baby like all those bush women again. I dey carry my baby for front. You say baby carrier fit hand my baby. How? Hello, I'm Dr Ijeoma. I'm a pediatrician, I'm a mommy, and lots more. Welcome to my channel. If this is your first time of coming to my channel, please subscribe, like the videos, share the videos, and if you have anything to ask me about what we are going to talk about, please do so in the comments. I have with me here Samuel James, a sign language interpreter. Today we are going to talk about how safe baby carriers are. We have the privilege of having Dr. Akindele Akintayo. He's a consultant orthopedic surgeon based in Canada. He's going to tell us how safe these baby carriers are. Stay with us.
Hello, good morning everyone. My name is Dr. Akindele. I guess Dr. Ijeoma has introduced me already, so let me cut to the chase. Today I want to talk about baby carriers, and I'll just briefly mention swaddling and DDH. Baby carriers are good only if you use them properly, and I will explain by what I mean by properly, but I'll talk about the advantages first. One, baby carriers are good because they keep the mom and the baby close, both physically, emotionally, and physiologically for the baby's bodily functions. Now, physically, the baby is resting on the chest. The baby feels secure, and baby feels relaxed. Now, emotionally, because the baby has been used to the mom's heartbeat when it was in the womb, and it was a reassuring sound, a normal sound, and the sound that the baby has been used to. So when the baby is on the chest, the baby hears the same beats, the same sounds, and it helps baby feel comfortable, the baby feel happy. It helps with fussy babies colic that cry, cry, and all that. Don't mind me, I love babies. So then physiologically, it helps keep the baby warm. Both the cloth used or the material used for the carrier and the mom's body, and it's good. Now, due to design and improper usage, a lot of people, because men and women should carry babies, not only women, and should not carry their babies properly. Now, there's a condition called developmental dysplasia of the hip. Basically, developmental means as the baby develops. So sometimes it can start from within the womb, which is no one's fault. And then sometimes it could also start from birth. As babies, it could also be from birth and as babies development. And there's some factors. Some of the factors are female. They are five times commoner in females than males. Firstborn females, and family histories and things like that in some instances. And there's some other mechanical and other features. Now, dysplasia means the baby hip or body part is not properly developed or has some issues with it, and then the hip. So based on this, we should be careful, because sometimes babies are born with normal hips and can develop dysplasias. And even if there are factors, sometimes it is the intermingling, the factors coming together that causes an issue. One factor might not cause an issue, so there might be an existing factor, and something else now adds to it and it makes it worse. And Dysplasia can present in many forms. Dislocation of the hip keeps popping out, popping in, we're in clicks in the hip. They can be diagnosed by the pediatricians or by the pediatric orthopedic surgeons or by orthopedic surgeons too. So it's always good to have baby checked. That's one. Two, if it's not popping out, it's possible that the hip is the bone of the thigh and the cup. These are the form the hip. If it does not pop out, it might not be in the hip properly. So what it means is that the head of this bone of the thigh is not formed properly, and the cup, sort of it being in a certain angle, might change the angle to accommodate where the hip is now located, which is not natural. This will make the head of the hip small. This might lead to dislocation later in life or even presently, and patient might need to have some procedures to realign the hip, and which most of us do not want. So it's proper to know what to do. Now, when you swaddle your baby, one, you look at what kind of materials what kind of carriers you have. The carriers where the bottom of the baby will rest should be a bit wide, because if it's wide, it puts the baby's legs, the hips and the knee in the proper position. And what is proper position? It's what they call the frog position or the M position, or some people call it the spread squat position, which is the best position. So the M position, which is easy, is draw an M. The tips of the M, a capital letter M, not a small m. The tips of the M are where the two knees should be, and then the middle of the M, there are like five points, but let's use the M like this. The two tips on top, the knee, and then the one in the middle is where the hip should be. So the knees, where the bottom should be, so the knees should be higher than the bottom. What does it? It makes the knees folded up, this folded up, and then the bottom down. So the knees are folded up and the bottom is down. And this position keeps the hips flexed and abducted. That means they are folded and they are open up. And this is the natural position of the hip and even the knees while the baby is within the womb. That's how God has made it. The only other instances that you will not have the hip or the knee in this position is breech, when baby is not lying the way baby should lie. So breech too is one of the risk factors for having a DDH. So this is important to note. Position your baby this way, then your baby is fine. And that's why they have groups, educational groups for mothers, which you guys are in one, and even people looking out for these things. Because if everything is fine with your baby and the baby has hip problem, it will affect the gait. That's the way the baby walks, and cause pain, cause discomfort now and later in life, and might lead to procedures being performed or casts being applied or harnesses being fixed. Because I've seen this a lot during my practice, and it's not, parents are not so happy. Now, a proper harness too is good because it supports the back of the child, which is supposed to be C-shaped. It's not the S-shaped that adults have. When they are young, it's C-shaped. So it supports the back of the child, because some people do not use commercially made carriers. They use cloths, which is also okay, but you must use it properly. That's one. If you use that properly, the back of the child is supported, because the child should not be an infant up to a certain age. I'll let the pediatricians tell you more about that. Should not be sitting on their backs. It's not right. Their bones are not strong enough to withstand the load of the head and of the other bones of the back. It puts a lot of pressure, and it can affect the back more than it should be.
Thank you very much, Dr. Akindele, for that eye-opening lecture. And that is the first part of the lecture. In our next video, we are going to take the second part of the lecture. Don't forget to subscribe to my channel, like the video, and I want to hear from you. How have you been carrying your baby? How do you carry your baby? Let me know in the comments. I remain Dr. Ijeoma. See you next time.